So we have Dr. Manish Singhal with us. Dr. Manish Singhal has done his DM in medical oncology from AIMS. He's a very dear friend, colleague, and a very intelligent doctor. And he gets a lot of accolades from his patients. And I'm really delighted that Manish has agreed to my invitation and has come here. And so let's listen to Manish, what he has to offer.
Thank you, Dr. Sachin, and thank you everyone to join in. I think this is one of its kind meeting where allopathic medicine and Ayurvedic medicine, holistic healing, everything is integrated into one. And this is not very commonly seen. And we keep living in our own very small world and keep treating and patients in our own way. But I think this is need of the hour because we are faced with so many dreaded diseases and cancer is one of them. And Sachin is partially a homecoming because I was brought up partially in Chandigarh and I studied in DAV school also, and lately I moved to Noida. So future of cancer medicine, treating cancer in 2040, can we treat cancer without chemotherapy? That's the topic which has been given to me. So there are several questions hidden within this particular statement. That is, what is chemotherapy? Why at all it is so dreaded? And what is the future of cancer medicine as far as allopathic medicine is concerned? And what is the prediction for 2040? Are we making headway? And last is not a question, it's a statement. We got to aim higher. Not treat cancer without chemotherapy in 2040, but cure cancer. And mind you, this Time magazine 2013 cover page is already talking about it. How to cure cancer. Yeah, please. So the drugs used in cancer medicine are called chemotherapy, and there are namely many of them. So alkylators, antimetabolites, topoisomerase, all jargon for a normal human being. But they are different drugs for different diseases. They are used in different combinations and they have different toxicity profiles. So making a generalized statement to say that all chemotherapies cause hair fall, that's not true. All chemotherapies do not cause hair fall. All chemotherapies cause mucositis, no, that's not true. So it depends on what type of chemotherapy and what combination you are using for what disease and what type of side effects you are going to face. But simply put, chemotherapy means cytotoxic drugs. Cyto means cell and toxic to the cell. It is unable to differentiate between a normal cell and an abnormal cell, and hence the dreaded side effects. What all? Nausea and vomiting. It can cause loose motions, mouth ulcers, body aches, nail changes, hand and foot syndrome, baldness, and sometimes can make you sick enough to land you in the ICU. So it is definitely dreaded and there are side effects. However, the interest diverted because of these side effects, the interest of the scientists got diverted to make targeted therapies. What is a target therapy? So we know that cancer cell is a different cell. It has a different biology, it has a different physiology, it has a different mechanism, it has different processes within, and we make use of these processes which make them different from a normal cell. So you have an abnormal cell, so you make a drug which is only working in an abnormal environment. Therefore, a targeted therapy, or simply put, it is like a laser bomb versus a clustered bombing. So it's a precise bomb. So simply put, it is as good as the difference between your old phone and your new smartphones. They are capable of doing much more, much easier, much faster, and without harming you much. So it's a precision medicine. The first time it came into light was 2001, and the Times magazine said that we have found new ammunition in the war against cancer. These are like bullets. And it was in chronic myeloid leukemia. Chronic myeloid leukemia used to be treated with chemotherapy at that point in time and transplant. And you can see that these are the survival curves. So even at 10 years, hardly any patient was surviving. Then transplant came in, bone marrow transplant. You were able to reach about 50% mark at 12 years. But this new drug called as imatinib, which is an oral pill to be taken, hardly any side effect, and you were reaching 95% mark. But scientists didn't stop at 95%. They weren't happy. They wanted 100%. This was breakthrough. So they started investigating patients who were resistant to imatinib. And they found that they developed newer drugs, bosutinib, dasatinib, nilotinib, and found that those patients who are resistant to imatinib, they could actually study the entire genomic material of the cancer cells and find out which mutation is there. These are the name of the mutations. Which site of the DNA the mutation was there, and the green signal means that the drug is sensitive and the red signal means that the drug is resistant. So they could pick and choose their therapy according to the mutation. So say for example, there is a mutation which is E255V which is resistant to imatinib. Your yellow is dasatinib is likely to work. So you can pick and choose your therapy according to the mutation. So the entire interest in oncology was to find biomarkers of response. That means you have a population of patients, you segregate them according to the mutation that they have. This may be disease specific, or one mutation may work in so many diseases. The disease may be XYZ and there is a pill for that. So you are segregating your patients into specific mutations, either disease specific or even non-disease specific, but a specific drug for each mutation. So there was a lot of bench to bedside work going on. Bench is when they were studying the molecular pathways which govern the cancer cells, and then they were trying to bring it to the bedside, that is in the clinic. So then the chapter of molecular oncology started opening, and we started understanding these various mutations and pathways which work in the cancer cells much better. And the scientists started working in developing drugs for each particular mutation. The best example was lung cancer. So there were a lot of biomarkers which were tested in the Indian perspective. The first one was the EGFR mutation, which happens in about 25% of total lung cancer patients. Then came the ALK mutation, then the ROS1, the MET amplification, and so many of them. So what you see over here is the 2014 guidelines of lung cancer, and you can see that these are the drugs that we used to have in 2014 for various mutations. And this is 2019 version 7, 7th revision within 2019 in lung cancer guideline. That means within 1 year you have so many, and we have not yet completed the year. And you will see how many drugs are available for each mutations. ALK mutations, so many of them. ROS1 mutations, so many of them. BRAF mutations, so many. And the newer mutations which are under investigation. So this is how the science is developing to make more and more biomarkers and more and more targeted therapies so that patients have lesser side effects and they live longer. Just to give you an example, this is against chemotherapy for ALK mutation, and this is an oral drug, non-chemotherapy, pitted against chemotherapy, and it is doing better. And now we have second generation, third generation drugs even beyond this drug. Just to give you a live example, this is an 85-year-old female diagnosed with lung cancer, and you can see that there is a lung mass over here. And with one tablet a day, there is a remarkable response as if the tumor has vanished. Then came the chapter of immunotherapy. Scientists used to believe that cancer is perhaps a failure of the immune system. How is it that if your immune system is able to recognize a virus or a bacteria as a foreign system and take care of it, why not the tumor cell? Tumor cell cannot be recognized as a normal cell. It has to be recognized as an abnormal cell. So this blue cell is your immune cell and this brown cell is your tumor cell. Then they understood that the tumor cell is secreting certain pathways or certain receptors are there which is causing negative interaction between the immune cell and the tumor cell. And they were namely called as PD-1 and PD-L1. So they were inactivating the T cell, the immune cell. And they developed antibodies against these receptors so that this negative interaction doesn't take place and you are able to kill, your own immune system is able to kill the cancer cells. So again, chemotherapy versus immunotherapy, and you can see that the immunotherapy is doing far better than chemotherapy. And these are the survival curves. Just look at this. The survival is way better and it is doubling. 14 months to 30 months. Pembrolizumab is an immunotherapy pitted against chemotherapy. So we are already working to minus the chemotherapy from the treatment of lung cancer, and we have done it successfully. We have doubled the survival without chemotherapy. And these are not my curves, these are international curves, available in public domain. And the survival of lung cancer, which used to be 0% at 5 years, in 2007, 2009, is now 25% at 5 years. So definitely we have made headway. You recognize this lady? Angelina Jolie. And we have to be very thankful to her, because she basically revolutionized the story of BRCA mutations, BRCA mutations. BRCA stands for breast cancer gene. That is, the BRCA gene is a gene which is inherited, and the function of the BRCA gene is DNA repair. So whenever a DNA replicates in our body, it has some aberrations. There are some breaks which has to be healed. And God has given us a gene called as a BRCA gene, which heals the repairs, the damages which happen during the replication of the DNA. When I was a student of DM, our book used to write that genetic cancers account for 1% of the total cancers. And we were so grossly wrong. We never knew, because gene sequencing was not easy. It was expensive, cumbersome, and used to take long time. But finally the lab techniques improved, and we started doing gene sequencing much easier, much faster, much cheaper. And we understood that in ovarian cancer, almost 20% patients have BRCA mutations. 20%. And now we are talking of preventing cancers. Nonetheless, even a cancer cell has to repair its DNA to remain alive, right? So a cancer cell which has a mutated BRCA gene, that means it is not able to repair the DNA properly, becomes dependent on some other factors so as to survive, and this factor is called as PAR. So scientists developed an inhibitor of PAR, that is olaparib, not a chemotherapy. And when they gave olaparib to patients who were BRCA mutated and had cancer, there was increased killing of the cancer cells, whereas the normal cell could rescue, because normal cell had a normal BRCA. So they could repair the DNA, the normal cell could repair the DNA, but a cancer cell which had a mutated BRCA could not repair the DNA, and hence died. So again, they had to pit it against chemotherapy. And what did they find? Chemotherapy versus olaparib. This is a waterfall plot. So this is the volume of disease, and this is decrease in the volume of disease, and each bar stands for a single patient. And this is the incremental benefit of olaparib. So not only it was causing good decrease in the disease, but much better than chemotherapy. So we are able to minus chemotherapy here. And these are the survival curves. So olaparib was a clear winner. No chemotherapy, treatment of ovarian cancer. Of course, when a drug becomes successful in a late stage cancer, you tend to bring it in the early stage of the cancer. So this is olaparib in first line treatment of ovarian cancer, and you can see how big is the jump. And mind you, we are talking of 60 months beyond. It's not yet touching the 50% line. So with placebo alone, you are hitting 12 months mark, and you are continuing on a simple drug, which is not a chemotherapy. Not only this, pancreatic cancer can also have BRCA mutations, and we had a study of olaparib. Pancreatic cancer is a difficult one, so not that good gain, but definitely a good gain with olaparib. Breast cancer can have BRCA mutations, and we have this study Olympiad, again pitted against chemotherapy, treatment of physician choice, which is chemotherapy versus olaparib, and you see that there is a remarkable gain with a non-chemotherapeutic agent, which is a targeted therapy. So not only this, one can predict future. So this National Geographic magazine, by studying the genomic material, they can predict that this child is likely to live up to 120 years. So we can predict that which breast cancer patient is likely to recur and which is not likely to recur. So this is a seminal paper in New England Journal of Medicine, adjuvant chemotherapy guided by a 21 gene expression assay in breast cancer. So what it does, it basically studies the cancer genes in a breast cancer patient and gives a prediction whether the patient is likely to recur or the patient is not likely to recur, or what is the chance of recurrence, and gives you a low risk, intermediate risk, high risk depending on the recurrence score. RS means recurrence score. So they did a very large study, more than 6,000 patients, and they found whether addition of chemotherapy is leading to any betterment in survival or not. So chemotherapy versus no chemotherapy, there was no improvement. They could prove that those patients who have a recurrence score of less than 25 did not require chemotherapy. So much so that 70% of breast cancer patients can actually avoid chemotherapy and have a excellent survival. You see the survival curve, more than 90%. So just to put the figures, overall survival was with chemo, without chemo. 5 year, 98%, 98%, 9 years, 93.9%, 93.8%. So 0.1% better. No chemo. So we are treating cancers without chemotherapy. Who is he? He is the Vice President, ex-Vice President of America, Joe Biden. And he had the cancer moonshot. He predicts that by 2025, America will be able to pump in so much funds into cancer research that they will be able to cure cancer by 2025. May or may not be true, but a good attempt. And if we were to believe this, man is anyhow going to be immortal by 2045. Leave apart curing cancer without chemotherapy. So did I not tell you that we got to aim for higher? Yes, if we combine science, the allopathic science, not that holistic medicine is not a science, I think holistic healing is something which is very much achievable. And with that, thank you very much. No matter how dreaded the cancer would be, I am in no mood to give up. With that, thank you very much.